Hello everyone. My today's discussion topic is pharmacovigilance terminology. Then first, vaccine pharmacology. Vaccine pharmacology is the study. It is a science and study of detection, assessment, understanding, and communication of adverse effect related to the immunization. That is the vaccine pharmacology. And we take example that is the Covishield, and to treat the we take the example of Covishield and. Then next that is vaccine pharmacology. Then next that is the initial date or awareness date. Awareness date means the company authority or the company authority known to the adverse report or case report. That is the initial date or awareness date, and there is having 4 criteria. For example, identifiable patient, identifiable reporter, suspected drug, and suspected reaction. And as I earlier said that vaccine pharmacology, there is an example Covishield, and to take the dolo means to prevention of the adverse effect of Covishield we take a dolo. That is the example of vaccine pharmacology. Then next term, that is the adverse event and adverse effect. Then what is the adverse event? In adverse event, there is a having untoward medical occurrence in a patient during a treatment, but their cause it is not known. Means in a medical adverse event, the cause it is not known, and in an adverse effect, the untoward harmful effect that observed in a patient and that there is a having caused by the drug. Means in a adverse effect, the cause is known. That is the adverse effect. Then next, that is the unexpected adverse reaction. In unexpected adverse reaction means someone, a healthcare professional, prescribed the drug, and the label of this drug there is a having not included that this reaction, and this reaction is caused by the patient. That is the unexpected adverse event. And then serious unexpected adverse drug means there is a having 5th criteria. First, there is a having death. Second, life threatening problem. Third, there is a having patient means disability the body function like a paralysis. And fourth, that is a hospitalization means prolongation of hospitalization. And fifth, there is a having a birth defect or congenital defect. That is the 5th criteria. Then next there is a having spontaneous report. Spontaneous report is divided into spontaneous report there is a having first unsolicited communication. Means unsolicited communication, the healthcare professional, the healthcare professional investigator that not known about the adverse reaction. Means they do not know know that the product caused this type of adverse reaction, and this adverse reaction is reported by the consumer or a patient. That is the unsolicited report. And in solicited report, the investigator, the healthcare professional that known that this type of reaction is caused by the drug, and due to that reason, the investigator and the healthcare professional that day to day get the feedback to patient or they arrange the different programs. That is a solicited communication, a solicited report. And then next there is a having solicited, unsolicited. And then next there is a having the suspected drug. Suspected drug means this drug that causes the adverse reaction. That is a suspected drug. And then next, that is a severe effect. Severe effect means in severe effect that causes the intensity means this mild, moderate, and severe intensity of adverse reaction. That is a severe effect. Then next term, that is the pass drug. Then what is pass drug? Pass drug means that the drug is continue, means the drug it is not in continue manner, or it is a discontinue before to start the treatment of new drug or treatment of suspected drug, and the first drug that do not related to the any adverse reaction. For example, pass drug means some patient before some dates some patient take the any tablet, antibiotic or any tablet, but after some days they stop the tablet, but after some days they taking their diabetes tablet, and that time the patient causes some reaction. So that is the pass drug. Then next pass drug, there is a medical history. In medical source there is a having to record the medical history of patient. Means they record all the patient related history to their birth they record all the history. That is a medical history. And then next that is the placebo. It is the sugar pill, or it is the it is not show any therapeutic effect in treatment, and generally placebo is a use in a phase 3 and due to the experimental purpose, that is the placebo. Means the term of placebo, there is a having no therapeutic effect, that is the placebo. Then now next, that is the abuse means the drug which shows which used for narcotic purpose, not for therapeutic purpose, that is the abuse drug. And then next there is a having off-label use drug. Off-label use drug means FDA approve that drug for one disease, but the investigator or the patient use that drug for other disease, that is the off-label use. Means for example, FDA approve the drug for diabetes, but the patient do not take the drug for diabetes, they take the drug for other disease, that is the off-label use. And on label use means that is the patient as well as the patient and doctor or the healthcare professional that known about the drug, means the both patient as well as healthcare, that both they known about the drug, that is the off label on label use. And then next there is a having blind. The blind is divided into two types, that is a single blind technique and double blind technique. In single blind technique, the patient as well as investigator that known about which type of drug used in their treatment, or which type of vaccine, which type of drug in the treatment, that is single blind. And in a double blind, the patient as well as investigator, the patient, investigator and healthcare professional, they do not know about the treatment, means they do not know which type of drug given to the patient, the doctor also known and the patient also known, that is a double blind technique. Then next, that is the IBD is the international birth date. Then international birth date means the drug launched in a market with the approval of marketing authorization holders, that is the IBD, international birth date. Then next, data lock point points is designed as a cutoff date, means and in which cutoff date there is a having data related to the signal detection, that is a data log point. Means for example, someone company says that reported the adverse drug reaction to the 15 March, so 15 March is a data log point. Means due to this due to the 15 March, the company known to the data related to the adverse drug reaction caused by drug. So that is the data log point. Means due to this date submitted the data, that is the data log point. Then next term, that is the signal detection. In a signal detection, there is a having to collect all aggregate report and to check all the adverse drug reaction. And for example, some drug causes 80% headache, and some people shows 20% nausea, some shows other problems. So which drug having more means which drug is a more causes, so that is the signal detection. Means find the adverse reaction which is more in range, that is the signal detection. That's all. Thank you.